October is Breast Cancer Awareness Month, and we as women know the importance of staying on top of our health and proactive in making sure that we get those screenings. So today we're at the Wake Radiology Cary Breast Center. I'm with Dr. Monica Reddy. I think every woman has heard the word mammogram, but not everyone realizes that they should be getting this done, right? So we recommend that starting at age 40, every woman get a mammogram every year. There are certain patient populations that need to start their mammograms earlier. And so we recommend that every woman starting at age 25 actually have that conversation with their primary care provider to see if they fall into that high-risk category. Now, let's talk about some of those risk factors that may put us in a category that we need to be on a different cycle. Two biggest risk factors for breast cancer are your age and being a woman, so you can't control either one of those things. Other risk factors that we need to know about are if you have a family history of breast cancer, especially in a first-degree relative, if you have had any prior biopsies, but especially ones that have had high-risk pathology, so atypia or things like that. Most patients know who they are. And then women with dense breasts in general are considered high-risk patient population. Can we talk about that a little bit? Because I know so many people go in, they get their results, and it comes back with the dense breast tissue, and it kind of raises those red flags, maybe in our mind, because we don't understand what you know. What would you tell a patient that has that on their result paper? So it's very common to have dense breasts, especially in younger women. Basically, all it means is that in some patient populations, you may need additional screening, like an ultrasound or an MRI, that kind of complements your mammogram. It does not take the place of your mammogram, but we may recommend that you kind of alternate every 6 months a mammogram with an MRI or an ultrasound, just as an additional screening that can kind of see through that denser breast tissue a little better than mammograms. Okay, doctor, we have our mammogram done. We receive a call. You tell us that there's something abnormal on the results. What's the next step? If you come get your mammogram, about 1 in 10 patients are going to get that phone call that their mammogram was abnormal. So don't panic. It's very common, especially the patients on their first mammogram ever. That's what I tell patients all the time. We don't have anything to compare it to, so we don't know, what's normal for you. So you will get a phone call from our office that will tell you that there is something on your mammogram we just want to look a little bit closer at. So we will schedule you for a diagnostic mammogram and an ultrasound. What a diagnostic mammogram is basically some specialized pictures to look at that area on your mammogram that we wanted to see better. Depending on what that mammogram shows, we may also do an ultrasound. And then after we get those pictures, a radiologist will talk to you that same day at your diagnostic appointment, and they will let you know one of 3 things will happen. We will say everything is fine, which is what happens with the vast majority of patients, that everything looks benign, nothing at all to worry about, and you go back to your normal screening mammograms in 1 year. Option 2 is that we see something, it is still most likely benign, but we're just going to keep a closer eye on it. So we'll follow it with either a mammogram or an ultrasound in 6 months. The third option is that we see something we don't know, but it could possibly be a cancer, and we just need to investigate further and do a biopsy. So what we would do is help you get all scheduled for a biopsy at one of our offices. What would you tell someone if they're just not getting a mammogram done because they're afraid? So we understand there's a considerable amount of anxiety associated with this whole process, even just getting just a normal mammogram every year. So we actually just opened this new Cary Breast Center about a month ago, and we really focused on the patient experience to make it as comfortable, as streamlined of a process as we could. The patient is always in a private room once they're in a gown, so they're not walking around in a gown, with other patients around. Everything is just very private, clean. We try to make it as kind of calming as an environment as possible. So how do we make that initial appointment? So you can schedule your screening mammograms yourself through MyChart if you have a UNC MyChart. We also have a feature, I think through our website, where you can text to schedule as well, or you can request an appointment through our website.
The preceding was sponsored by